Chris, do you and Mr. Chris? Good morning, everyone, and thank you all for joining us today, the City of Fairburn's Mental Health Awareness Live Panel Discussion. I'm TaLisha Champagne, I'm the Human Resources Director, and I am excited to be with you today. Of course, life oftentimes, it gets very hectic and it can become challenging for many of us to prevent our personal situations from impacting us at work or just kind of in our day-to-day. And so, of course, this month is Mental Health Awareness Month. And in observance of this month, we're taking this opportunity to have a live panel discussion. And our theme for today is mental health awareness. Together, we are stronger, and we are more than enough. I'm so excited to have all of the panel members that are here with us today. Those of you who are tuning in live, thank you so much. Please drop any emojis, thumbs up, smiley faces, hearts that you have, and also our employees who are also live in our audience on today. So I'll pause here and just take an opportunity to allow each of our panel members to introduce themselves, starting from my left to my right.
Good morning. I am Sergeant First Class Retired Denise Grayer. I am with the local VFW chapter, post 6449 here in Fairburn. I am the Veteran Service Officer for our post.
Thank you so much for being here.
Good morning. My name is Anthony Bazidlo. I'm the police chief here in Fairburn. I've been with the city for 17 years, and I'm currently a post-certified general instructor as well.
Good morning. My name is Cornelius Robinson. I'm the fire chief for the city of Fairburn. I've been with the city for 17 years, 30 altogether. As a matter of fact, me and Chief Bazillo started the same day, and now here we are.
Okay.
Good morning, everyone. My name is Pam Braxton. I'm a licensed clinical social worker, and I'm the community outreach coordinator for Odyssey Family Counseling Center in College Park.
Good morning. I am Kathleen Murray. I am with Corpcare EAP. We are the City of Fairburn's Employee Assistance Program provider, and I am also a licensed professional counselor.
And good morning, I am Craig Hinner. I'm with UnitedHealth here, and I am the account manager for City of Fairburn.
Again, thank you all so much for being here. So let's start first by just defining mental health. So when we look at mental health, what is it? It can be defined as the emotional, the psychological, and social well-being of an individual. One's mental health certainly contributes to how we think, how we feel, and how we act, and it's definitely how we are resilient as relates to our relationships to others. So I'm going to start with public safety because, as you all know, we recently had an active shooter event that happened in the city of Atlanta, and even though it happened in that city, it certainly was impactful to all of us. So can you all just kind of talk through and help us understand how mental health is impacting public safety and how you all deal with the community as it relates to mental health incidents?
Definitely. I think it's a huge impact on public safety, and I think Chief would agree with me. When people are in crisis and there's some kind of need for a service, when they don't have an option to access care or someone to help them get there, generally speaking, they're going to end up with a public safety response, either police or fire or both. And certainly from our perspective, we feel that burden when we're getting these calls that really don't have a law enforcement need. It's really more of a care need, right? A lot of that burden gets pushed to public safety. So police are going to respond, and we are increasing our training in terms of how to deal with people in crisis. The crisis intervention training is offered by the state of Georgia, which we're pushing for that. We've actually got one of the members of the command staff going to begin resiliency training for more our internal training, so we make sure our officers are being trained on how they can deal with their own mental health, which I'll touch on very briefly. I had just a few notes here. Police officers, and I'm sure public safety as a whole, We experience higher rates of depression, anxiety, PTSD. There are more law enforcement deaths by suicide than line of duty deaths, and most law enforcement officers do not actually seek care. So the stigma around mental health, I think, is an issue for us internally to make sure they're not, and by internally I mean law enforcement as a profession, that we remove that stigma and make sure that officers and public safety in general make sure that they are encouraged to get care, to identify where issues are, and then on the external side to make sure that we're getting the training we need to be able to respond to people in crisis in an effective way, to focus on getting them care rather than a strictly law enforcement function. And again, I think the fire department is right there with us in terms of how many calls we respond to, Chief.
Just to tag on to Chief Mazzillo, of course, you all know public safety in itself, police and fire, is a very stressful occupation. We see a lot of, not to sound harsh, but we see a lot of major trauma on the interstates in the city. We see a lot of death throughout our years, and it does take a toll on the men, mentally and physically. To tag on to what Chief Mazzillo said, I made some notes on stuff he's briefed on, because we kind of interact the same. One thing we do is we encourage open communication with our guys, and that helps them kind of, ease the pain of mentally what they've seen. Of course, we've come to you to offer assistance with, any type of counseling, and we appreciate that. Definitely providing our firefighters with mental health resources to cope through things that we go through. Offer training, and more so than anything, foster a culture of, mental wellness for the guys.
Absolutely.
Talking to them and different things. For us, recognizing the signs when police and fire have issues within our department, looking at the mood swings, their job performance, because we know what our men are capable of. We know how our guys operate. So if we see change in there, that throws a flag for us. And one of my other notes is, just being supportive to the men. And if we have an issue and we have to take it further, we can come to human resource or come to our city administrator, our assistant city administrator.
And Chief Brazitlo, you mentioned training. Can you just talk briefly about how integral, how important the training is for our police officers as they are interacting with our public that may be experiencing a mental illness? How important is that training for your officers?
It's absolutely crucial, and this is training that didn't even really exist at some point a couple decades ago, so this is all kind of new area that we're moving into. But the training is absolutely critical when you're recognizing someone who is in crisis and maybe suffering from some kind of mental issue or substance abuse is sometimes a factor, but being able to recognize that. One of the things officers deal with most often in cases like this is what they may perceive as noncompliance when they're being given an order by an officer, as opposed to a person who is struggling to be able to comply. And those are kind of two different things. And the training that we're getting, helps to recognize what signs officers can look for to identify that this is someone who's actually in crisis of some kind, as opposed to willful noncompliance, which is a totally different thing. So.
Understood. And then very lastly, you all spoke to the collaboration. As we mentioned, the active shooter, it was so amazing to see how, even though it took place in Atlanta, how several cities really just kind of came together to help, be able to deal with that particular crisis. How important is it for the two of you all to work together when you're having to deal with a mental illness incident on scene?
Go ahead, Chief.
Well, for public safety, we're like one whole family. Even though police do what they do and fire do what they do, we're like a family. And I'll tell you something else that helps out is being supportive of the firefighter and police officers' families.
Yeah.
That's a big deal. 'Cause it carries on to the house. So we definitely have to be supportive of that.
Thank you all so much. Now, while we understand that mental illness certainly impacts our public safety, we are always so excited and very grateful for the service that our military personnel provide to us. So, retired Sergeant First Class Greer, can you just kind of talk briefly about what challenges that you're seeing as it relates to our military personnel, and how those challenges are contributing factors to mental illness.
Okay, thank you again for having us this morning. So we know that the military itself is a unique employer, and we face unique challenges, and some of those unique challenges are combat exposure. Military personnel are exposed to indirect and direct combat exposure all the time, and it could lead to post-traumatic stress disorder, which is PTSD, which is one of the most applied for disability benefits among veterans, is post-traumatic stress disorder. Some of the other challenges include deployment, and which is a high stressful environment itself. A lot of soldiers are being deployed multiple times. Because the numbers of the military force has decreased, you have individuals that are going almost back-to-back deployments overseas, and that, of course, allows them to be away from their family, away from friends, which is also stressful, which could also cause mental health, especially when you have individuals who have never deployed. One of my last deployments, I took in my department 7 young men with me, and neither one of them had ever deployed before. And so you could see, and I could, had to work with them being in a new environment, in a stressful environment, and away from their family. All those things can lead to the mental health challenges of the military. And then you have the lack of support. And what I mean by lack of support is the mental health facilities for individuals that are in rural locations, that live out in rural areas. So those are some of the challenges that we see.
Okay. And what barriers do you believe veterans are facing in being able to access mental health services? And what approaches would you recommend that you believe would improve the treatment and prevention of mental health as it relates to our military personnel?
So some of the barriers that I noted were systemic, individual, and societal. And under systemic, I noted that there was insufficient resources of mental health and funding at some of the VA locations. And low budgets leads to lack of resources, and which could cause, insufficient resources for veterans. And individually, we have a stigma of mental health literacy, and we have limited awareness. So believe it or not, there are a lot of vets that will not go to mental health because of the stigma. So if you have an individual that was we call them 11 Bravos, field artillery or infantrymen, they have a stigma that, and then you have some Marines that have a stigma of not going to mental health, okay? And then there are limited awareness too. There are veterans that just think that the resources aren't there, and they are in every VA facility and in every VA clinic. They have mental health awareness, but folks don't know about it. And then there's the societal barrier of transitioning from military back into civilian life, finding a job, getting the family situated. A lot of military folks, like myself, grew up if you will, in the military, left high school, joined the military, and did over 20 years. And when you come out, you had the military kind of taking care of you from everything from health care to food, and then you come out and you have to kind of reorganize and do those things. But some of the things, the new approaches that I think would help improve it would be early intervention and prevention. So as a military or exiting the service, I think it would be great if they had someone to do crisis intervention then, to do screenings there, to do wellness programs as they're exiting out of the military. Also, peer support groups would be a great improvement for the military. We do have them in VA clinics, but if we could enlarge that area. And the biggest improvement, I think, would be collaboration and coordination with other entities, other hospitals, also, you know, fire and chief, fire and police, because they also have mental health programs. And if we could coordinate and collaborate with the VA, like Emory has a program for mental health awareness for veterans. So some of those things are what I think could help improve our mental health program for the military.
Thank you so much. Now, as we kind of mentioned, Pam, mental health kind of affects how we think, how we feel, kind of how we show up. But there are other elements that go into that, and one of those being self-care. So what is self-care, and what do you believe, how do you believe self-care kind of impacts our mental health?
Well, thank you for the question. So self-care is simply caring for yourself. It's treating yourself with love and kindness, even with our imperfections. So it's being aware of your physical, emotional, spiritual, psychological needs and tending to those needs. So it's a compassionate choice to do what's best for you, which is not always the easiest thing to do. So sometimes we do have to make difficult decisions, like setting boundaries with people, sometimes saying no, standing up for what we believe in, and being honest about your feelings. So practicing good self-care can impact mental health, so it can boost motivation and energy. Studies have shown that self-care reduces depression, anxiety, stress, anger. And also, self-care helps to avoid burnout. We talk about that a lot, especially at work. You know, setting those boundaries, not talking about work at home, not bringing, you know, work home. So these are some self-care techniques that we can do as far as how it impacts our mental health.
Okay. And what type of self-care tips or practices would you recommend that you believe would kind of help improve our mental well-being?
So first I want to say it's very easy. You can always Google self-care tips, right? But when it comes to mental health, as I stated, self-care can help to manage stress, and it also lowers risk of illness. So some examples. So some physical self-care: exercise, eating healthy, staying hydrated, making sleep a priority. Now that sounds really simple, but a lot of us don't do that. You know, a lot of us don't sleep 7-8 hours a night, or eat healthy, or just drink water, right? So relaxing activities helps with stress, meditation, mindfulness meditation, deep breathing. There's wellness apps out there that you can use. You can conduct enjoyable activities, things that you like to do: cooking, dancing, gardening, knitting, arts and crafts, hot baths, hot showers, massages. It doesn't have to always cost money, right? Setting goals and priorities, deciding what needs to be done now and what can wait. Learn to say no. As we said, no is a complete sentence, right? And also learn how to set those boundaries. Practice gratitude. You know, recite daily affirmations. That increases self-esteem. That increases confidence. Focus on positivity. It is so easy to focus on the negative and the glass being half empty, but we can restructure our thoughts and think, well, you know, maybe it's not so bad. Let me find something positive in this situation. And also stay connected to people. Reach out to family and friends who provide emotional support and practical support. And I also would say create a self-care plan, right? When you're journaling, or if you have a notepad, you know, write down activities that you want to do that day, right? You can journal if you want to journal, if you want to walk, if you want to exercise or whatever. Set an alarm to remind yourself to do that activity. Turn off your phone, turn off the social media, get rid of all these distractions, right, during that time. And also, too, if you want, let other people know that you're, you know, setting this self-care plan for accountability, and make self-care a priority.
Thank you so much, Pam. Just from a human resources standpoint, I can say that mental health is certainly impacting the field of human resources. You mentioned stress and burnout. Statistics show that stress and burnout are on an all-time high. Factors also show that over $1 trillion in 2022 showed a loss in productivity as it relates to mental health and burnout and stress. And so oftentimes we see where our employees are just too stretched, like they don't have the bandwidth to really be able to kind of fulfill all that they're having to do, whether it's in the workplace or whether it's at home. And so certainly for us, the recommendations that I would provide is that HR professionals, we need to really take the opportunity to start having hard conversations and tough discussions with our leadership to talk through what type of workshops are we providing our employees? What type of employee assistance programs are we providing? What does our benefits look like? How are we measuring the efficiency as it relates to our benefits? And speaking on, as it relates to that, Kathleen, I know that you work so well with us as it relates to our employee assistance program. The first thing that I would like to ask of you is how would you identify mental health? Because oftentimes I think with the stigma, we place a title on mental health as it relates to maybe one thing. But let me know if you agree with me, many of us deal with mental health. Stress is mental health, right? Anxiety is mental health. So let's first kind of talk a little bit about how you would identify it.
Yeah, for sure. You did a great job of identifying it right out the gate. It's how we think, feel, and act, right? So it looks different for everyone, but there are some pretty general markers that we use to determine if there is a mental health issue or if something's going on with someone that they may need some help with or we need to address. And so that can look like changes in sleeping and eating patterns. That's a really big, easily identifiable one out the gate. Social withdrawal, loss of motivation, lack of interest in activities that one would typically participate in, worry and stress, right? The overuse or misuse of certain substances to cope. These are some issues that we see, especially in the EAP world, but some pretty easily identifiable markers for friends, family, coworkers to kind of pay attention to and other people.
Absolutely. And what overall impact do you see employee assistance program providers? What overall impact are you all seeing mental illness?
Yeah. So I think it's safe to say that rates of anxiety and depression only grew and increased throughout the pandemic, but especially now in this kind of post-pandemic phase that we're in, we're really seeing the residual effects of the uncertainty, unrest, the grief, the loss, the collective trauma that was the pandemic. So in the EAP world, our providers are seeing, like I mentioned, increased rates of anxiety and depression. We're also seeing increased telehealth visits. So the modality in which we treat our employees, our clients, has changed to a widely telehealth model, which is great and just expands our ability to provide the care that is really needed.
And how do you believe the employee assistance program supports families that are also dealing with mental illness?
Yeah, so our EAP benefits extend not only to the employees of the organizations that we service, but also to their household members. So those services include mental health counseling sessions, financial and legal services, and what we call work-life referrals, which are referrals for childcare, elder care, convenient services like home repair services or pet sitters. So we really work to help employees balance their life, personal life and work life, and also their families. So their families can also access these services and these benefits if they are struggling with a mental health issue or need a financial consultation. So we really work to reach not only the employee but their family by offering our services to them as well.
And just, meeting and collaborating with HR colleagues, kind of one of the things that I hear just recently as it relates to EAP utilization is, many of employers have increased the amount of visits that their employees can receive. But the utilization is still kind of not as high as it really should be. So what do you believe as it relates to the stigma of mental health, and does that have an impact on our employee utilizing their EAP benefits?
Totally. Stigma has an impact on the mental health field at large, but especially in the EAP world, because we are connected to their workplace, their employer, right? So people struggle with worrying about confidentiality. Will my employer find out? Will my coworkers know that I went to see a therapist for anxiety, things like that? So stigma plays a huge role in people, from just gathering information to preventing people from reaching out, asking for help, all the way to preventing people from actually accessing services. So that is why events like this are so important, and for workplaces to really encourage talking about mental health and accessing their EAP services, accessing mental health services outside of the EAP as well, just to help minimize that stigma and hopefully increase utilization.
And just lastly, I just want to touch on that word confidentiality. Just talk a little bit about how important, so that we can really kind of encourage and get our employees more comfortable with understanding just how confidential their information is. Can you just kind of speak to the confidentiality part of EAP?
Right, so our EAP providers practice the same confidentiality practices that any private practice clinician would provide under the HIPAA laws. So your personal health information, your PHI, is not disclosed to your employer. It's not disclosed to anyone outside of your provider, outside of our EAP database, and no one has access to that except for us at the EAP.
Thank you so much for that. And then Craig, also just from the medical standpoint, you are a field account manager, and you've worked with UnitedHealth Group for quite some time. Can you just kind of speak a little bit as it relates to how mental health is impacting medical providers?
Yeah, for sure. I think it starts with when I first started here 7 years ago. Mental health wasn't even part of this conversation. I've been doing open enrollment meetings for years, and preventative care was always the thought process in regards to colonoscopies, your annual visits that you go out to. Preventative mental health care wasn't even a conversation 7 years ago. Today, not only is it a conversation, it's sometimes the forefront of these meetings that we go to. It's something that members have the biggest questions for when we go out to see. And with that, 7 years ago, we didn't have a full suite of resources. Now we do. We have provider searches on there. We have applications on our phone that are more preventative based. We have crisis center lines. We have just a wide range of resources that are not available to help with any issues that people have on a wide spectrum too. Sometimes we think of the big ones, the depression, the PTSD. Sometimes it can just be mild anxiety, some minor problems that we want to get ahead of before it blows up and we have a blow up at the end, and we need those bigger resources. So it's just nice to see a wide range of resources now available for all members, regardless of where they are on their journey.
And one other thing that really kind of impacts mental illness is individuals that don't have immediate access to medical. They don't have a medical plan, or they don't have the resources to obtain medical benefits. So kind of what tips or resources would you kind of recommend for those individuals that don't have immediate access to medical care?
Yeah, what I always like to recommend is there is always a astounding amount of literature that is out there online now. There's some great resources out there at different universities, even different free apps that we have. UnitedHealthcare, we have a Salmonello app, which is a premium version for UnitedHealthcare members, but there's a free version out there for members as well, that they can access those resources. And this is also a good time that when you're having those questions, if you have mental health questions, it's a great thing to put in your back pocket for open enrollment season. A lot of time when open enrollment comes around, we think we may not need the medical plan. We You may just have those basic questions on copays and deductibles. Ask those questions about what are the mental health benefits that are out there? How many EAP visits do I have? What kind of coverage do I have from a preventative basis in regards to mental health questions? Open enrollment is such a small time frame in the year that sometimes we forget to ask those questions when it rolls around. So again, it may not be your open enrollment time, but maybe these are the questions you take away for open enrollment season.
All right, do we have any questions from our live audience, Mike? So we have our employee audience that is here. Do you have any questions out there in the audience that you would like to ask of any of our panel members?
Good morning.
Good morning.
So I'd like to thank each of you as panelists for coming today. It's been a very interesting conversation, and one of the common denominators that I heard throughout all of your comments, or at least several times, was about the stigma associated with mental health issues. And we've heard a lot about that, and I think the conversation would help us now if we begin to talk about how we normalize mental health, because that seems to be the next step. Having been in the public sector nearly 25 years, and even in my own personal life, when we come across either coworkers or family members that have other health conditions, diabetes, high blood pressure, you're often encouraged to get medical attention. And if you have a family member dealing with that, you say, hey, you need to see a doctor, or hey, you need to pay attention to your health. And we're not quite there when it comes to mental health.
Yeah.
There's still this shame attached to it. There's a reluctance not to talk about it. Certainly in a lot of areas in the military, I know you mentioned that specifically, public safety is also the case, but I think it's the case for all of us. Yeah. And so this is a tremendous event. I love the dialogue. We have to talk about how do we normalize this in day-to-day conversations, and specifically for us here in the city of Fairburn, how do we help our employees to lower that wall that tends to be there when employees have mental health issues, and helping people to understand that it's normal. It's no different than any other health issue that you have. And so I think we need to figure out, and I don't know what your thoughts are about, how do we make it normal to get away from the word stigma? Because as long as it's still a stigma, that means it's different. It's not like other health issues. And that's the wall I think we need to break through, is to figure out, what are your thoughts around how we normalize discussions about mental health, which really is just another health issue?
I'll just kind of start from a human resources perspective. I think that having events such as this and understanding, even, to my colleagues, that mental health, while May is recognized as Mental Health Awareness Month, that we don't just discuss it or talk about it just in the month of May, that we continue the conversations throughout the year. In addition to that, just kind of making sure that we have an open door, making sure that, we are having those conversations about what do our plans, kind of look like, and training our managers in identifying what mental health could potentially be. Because oftentimes if you have, such as an active shooter or a workplace violence situation, oftentimes it's because we've ignored the signs. And so providing that training, not just to our employees, but to our managers as well, to first look at identifying what mental health could potentially look like. I'll go to you all in public safety. How would you say, in relation to Mr. Phillips' question, how do we normalize or getting our public safety personnel to come forward more and deal with any type of mental health issues that they may be experiencing?
I definitely think it starts with leadership and making sure that you're putting down the message that mental health is something that we all deal with. It's not an issue of if, it's a matter of when employees are going to have issues with mental health, or we ourselves as leaders are going to encounter it as well. So I think just that open dialogue and being upfront about it, and just encouraging people to not only take their own mental health under consideration, but the people that work for them and their mental health, and just having open conversations about it. I think sometimes just sharing a personal story, about a family member, a loved one, encountering something like that, to kind of maybe soften the blow a little bit. Just why, you don't, instead of just running up to someone and say, hey, how's your mental health? Kind of lead into the conversation a little bit. And sometimes I think that might be an easier way to get into it. But I do think it starts with leadership. It starts at the top to have those conversations and filter down.
Kathleen, did you have any?
Yeah, well, I agree exactly with what you just said. You mentioned leadership, and I think modeling that behavior is so important. If you want your employees to feel safe and like this is an open space for them to talk about any mental health issues or concerns, you've got to start that conversation yourself and really model that for them, because it's hard to be vulnerable at work. People feel like there's so much on the line. So just, yeah, being brave to be the one to initiate that conversation and model that for your people, there really will be a trickle-down effect from being able to do that. And again, having events like this is so great, because it just implicitly states this is an open and safe environment.
Absolutely. I'd like to add to that too. That's a really good question. Thank you for it. So I think it's important for us to be educated on what mental health is, and perhaps maybe have trainings here just to kind of talk about what it is, have an open dialogue where people can kind of talk about it. We all experience it. No one is exempt from feelings of depression or stress or anxiety. And like someone said, even if it's just a little workplace anxiety, some anxiety is good. I'm sure some of us felt some anxiety coming here on this panel, right? So it's okay. And also too, I always say when I work with clients, our head is connected to our bodies, right? So what we think and feel, it does impact us physically, and our physical health also impacts our mental health. So our head and body is connected. So I think education is important.
Absolutely. And can I add that along with mental health and normalizing therapy, because when we think mental health, we just go to the different diagnoses. We go to the anxiety, the PTSD, the depression, but we need to let it be known that therapy is okay. It is okay to talk about seeking a therapist, talking to a therapist, and for the military, doing those things from entry to exit. When they come into the military, I think it would be a great approach to talk about mental health, to talk about therapy, to let it be known that it's okay to seek therapy and to seek counseling if needed, and on the way out, exiting the military, also discussing those things. So along with mental health, not just focusing on those diagnoses, but to focus on some of the treatments along the way, which is the therapy and counseling.
Absolutely. Thank you for that question. Any other questions from our employee audience? Did I see a hand in the back? No other questions? Well, again, thank you all so much for being here. We're always so grateful to have our employees and certainly our leadership supportive of our wellness initiatives that we have here in the city. So grateful for each of our panel members that were here today, a very diverse panel. Thank you all so much for all that you offered as part of this panel discussion today. As you all know, again, the theme is mental health awareness. Together we are more than enough. And that is because we do this together. This is not an individual situation. This is something that we can all overcome, and we are all bigger and we're stronger than just the two words, mental health. And we're stronger together, and we're more than enough. And so I just want to say thank you all so much for being here. Okay, we do have one more question. Come on up.
How's everybody doing?
Good.
My question is, I tend to deal with a lot of people with bipolar disease, mental illness, and I'm trying to figure out how to deal with those type of situations. Can you give me some, excuse me, a little hoarse. Give me some insight on that? Let's hope it.
I think, so instead of getting to specific illnesses, I think that does kind of speak to the broader training that I know we go through. Actually, our required monthly training, we have some online training we do, and dealing with mental health crisis was a training class we just put on, and they did cover a variety of different illnesses. and different situations that certainly PD has, how we can respond. For example, one of them was, I don't remember the specific illness, but the advice for the officers in the training was, don't whisper, don't, be off in the corner whispering to another officer. Don't ever tell a lie. Don't tell something that's not true. Don't agree with somebody if somebody is perhaps having a hallucination and says, they see something over there. Don't agree with them, because at that point you've lost trust, because if they're suffering through a mental health crisis, you don't want to make it worse by losing their trust. So that kind of specific training that did kind of cover a different number of mental health issues and situations that people might be going through. So we did kind of touch on that a little bit.
Okay.
I'd like to add something. Also, too, I would say to be supportive to that person, ask them what it is that they need, right? In the workplace, being educated yourself on bipolar disorder, if that's what they have, and just be supportive and ask them what it is that they feel like they need from you.
Okay. All right. Appreciate it.
Thank you. Any more questions? So again, thank you all so much. I truly hope that information that was provided today, tools, tips, resources that was provided was certainly impactful to each of you, not just to our employee audience that is here, but to any of our viewers that are viewing this live. I am truly hoping that we do take the opportunity to not just do kind of some self-awareness, but that we will also take a look at any of our family members, and if we're starting to see signs that could potentially look like mental health, that we would, as Pam just mentioned, be supportive and seek additional help, counseling, therapy, or utilize those self-care tips and resources that was provided to us. We would dare not end this event without allowing the opportunity for our city administration to be able to kind of close out. Again, we're so very thankful for our leadership team here, who is always so supportive of our wellness initiatives, and we really appreciate that. So we would like Mr. Phillips, our city administrator, and/or Ms. Chris, who's our assistant city administrator, to come up and close out our panel discussion for today.
Well, good morning. I just want to say thank you to our HR department for putting together this panel, and this is discussion that's really needed in the community. I want to thank our employees, either those that's viewing online or those that's with us today, for actually coming, because mental illness is real. And as we go on our day-to-day journeys and we deal with the joys and challenges of life, sometimes we encounter situations that are difficult to deal with, and them knowing that we do have open doors. We have an HR department that's willing to listen and is providing the resources. So I just want to say thank you for putting this together.
Thank you.
And I will echo Mrs. Chris, thanks to each of you as panel members. And what I would say in general for this effort is that as a city, we see mental health as an important issue. And we are supportive of all of our staff and helping them understand that this is a safe place. We want our employees to always know that and to feel that, and we want that to be an everyday part of our culture. So thank you to our Human Resources Department and Ms. Champagne and her team for highlighting this issue. But we want this to become a regular part of who we are. And so my message to all of our coworkers is, you're safe here in the city of Fairburn, and that you don't have to feel any stigma or any shame. I've dealt with mental health issues in my own family. Most of us probably have. You said it's not if, but when. It's a reality of life. And so we want all of our staff to understand that here in the city of Fairburn, we see that as a wellness issue, and that you're safe when it comes to the city of Fairburn. Thank you.
So much. Thank you all so much. Enjoy the rest of your day.